Did you know that over 70% of adults have experienced some form of trauma in their lifetime? Research from the National Council for Behavioral Health suggests that trauma significantly impacts mental health, emotional well-being, and, most importantly, relationships. But how exactly does trauma shape the way we connect with others? And more importantly, how can we heal from it to build healthy, fulfilling relationships? Today, we're diving deep into the evidence-based psychology of trauma and relationships. By the end of this video, you'll understand how trauma affects self-worth, attachment, and communication, and learn strategies to rebuild trust and emotional security. So let's get into it. Imagine someone who grew up in an unstable household where love was unpredictable, or someone who survived a deeply painful event, such as an accident or assault. These experiences don't just fade away, they shape how the brain perceives safety and connection. Trauma alters brain chemistry, particularly in the amygdala, which processes fear, the hippocampus, which handles memory, and the prefrontal cortex, which regulates emotions. According to research published in the Journal of Traumatic Stress, individuals with unresolved trauma often experience heightened stress responses, making them more prone to anxiety, hypervigilance, and emotional dysregulation. There are different types of trauma, and each impacts relationships differently. The first type is acute trauma. This is a single distressing event, like a car accident or natural disaster, that can lead to trust issues and avoidance behaviors. The second type is chronic trauma. This is more like ongoing abuse or neglect that can damage self-esteem, leading to codependency or fear of intimacy. The third one is complex trauma. It is mostly repeated exposure to harmful situations, particularly in childhood, which can create deep-seated attachment wounds and difficulties in regulating emotions. Regardless of the type, trauma's impact on self-esteem is profound. Many survivors struggle with feeling unworthy of love, leading them to either withdraw from relationships or seek validation in unhealthy ways. Trauma doesn't just affect the survivor, it impacts their partners, families, and friendships. So what are some ways that trauma can influence relationships? The first could be communication breakdown. Most often, trauma survivors develop defensive mechanisms such as shutting down, avoiding conflict, or becoming overly reactive. A 2019 study in the Journal of Family Psychology found that couples where one partner has post-traumatic stress disorder, often called PTSD, report significantly higher levels of miscommunication and emotional distance. For example, a person with trauma might interpret a partner's request for space as abandonment, triggering intense emotional reactions. The second impact could be attachment challenges. Here, trauma survivors may develop anxious attachment, where they fear rejection and cling to partners, or avoidant attachment, where they push people away to prevent getting hurt. For example, someone with childhood neglect may struggle with trust, making it difficult to open up in romantic relationships. Another impact could be re-traumatization. Unresolved trauma can create patterns where survivors unknowingly seek out familiar, even unhealthy, relationship dynamics. This is known as trauma reenactment, a subconscious attempt to recreate past wounds in the hope of gaining control over them. For instance, a person raised in a chaotic environment might feel drawn to emotionally unavailable partners, thereby repeating the cycle of abandonment. Healing from trauma is difficult, but it is absolutely possible with the right support and approach. Trauma affects both the mind and body, so recovery requires patience, self-compassion, and often professional guidance. The first is seeking professional help. One of the most effective ways to heal from trauma is through therapy. Talking to a trained professional can help you process painful memories, manage emotional triggers, and develop healthier ways to cope. The two evidence-based and highly effective treatments for trauma are trauma-focused cognitive behavioral therapy, or TFCBT, and eye movement desensitization and reprocessing, known as EMDR. Let's briefly explain what these two therapies do. Trauma-focused cognitive behavioral therapy, or TFCBT, helps individuals, especially those who have experienced childhood trauma, understand how their thoughts, emotions, and behaviors are connected. It teaches practical skills to manage distressing thoughts and feelings. Studies show that TFCBT significantly reduces symptoms of PTSD, anxiety, and depression. Eye movement desensitization and reprocessing, or EMDR. This therapy helps the brain reprocess traumatic memories in a way that makes them feel less overwhelming. During EMDR, a therapist guides the person through recalling their trauma while following a specific set of eye movements, tapping, or sounds. Research has found that EMDR can reduce trauma symptoms faster than traditional talk therapy. Healthy relationships are possible for trauma survivors, but they require intentional effort. So here's how to build resilience. Number 1. Develop self-awareness. Recognizing personal triggers and emotional patterns is the first step. Writing and mindfulness practices can help identify when past trauma is influencing present reactions. Number 2. Prioritize open communication. Trauma survivors often benefit from discussing their fears with a trusted partner. Using I statements like "I feel anxious when plans change unexpectedly" can foster understanding rather than blame. Number 3. Create a safe emotional space. Consistency and predictability help trauma survivors feel secure. Partners should strive to be patient, validating, and reassuring. Number 4. Set healthy boundaries. Trauma can blur the lines between personal needs and people-pleasing behaviors. Learning to set firm yet compassionate boundaries is key. Be sure to watch my video on how to set healthy boundaries for details on boundary setting. The final one for today is to practice grounding techniques. Simple strategies like deep breathing, sensory grounding, such as holding a cold object, or body scans, can help regulate stress in moments of emotional overwhelm. Healing from trauma takes time, but with the right support, individuals can cultivate healthier relationships. Research in the Journal of Positive Psychology highlights that post-traumatic growth is real. Many survivors develop deeper empathy, stronger resilience, and a greater appreciation for meaningful connections. So what have we discussed today? Trauma deeply impacts self-worth, attachment, and communication patterns. It can lead to emotional distance, trust issues, and even relationship cycles that mirror past wounds. Healing involves self-awareness, professional support, open communication, and intentional emotional safety. With the right tools and understanding, trauma survivors can build strong, loving, and fulfilling relationships. Have you noticed how past experiences impact your relationships? Share your thoughts in the comments. I'd love to hear your experiences. And don't forget to check out my other videos. Thank you for the support so far, and see you in my next video.